You may heard about diabetes, and also doctors talk about blood sugar every day. But very few people are told what diabetes quietly does to the kidneys. High sugar doesn't just affect energy or weight. It slowly scars the tiny filters that clean your blood, and most of the time, it does this without pain. Many people don't realize anything is wrong until real damage is done. And in today's video, we'll show you how diabetes pushes kidneys toward failure, the early warning signs most people miss, and what changes can protect them before things turn serious. So be with us till the end to know everything about diabetes and kidney failure. What diabetic kidney disease actually is. Before this goes any further, it helps to ground one thing clearly. Diabetes is a condition where blood sugar stays higher than it should because the body either doesn't make enough insulin, doesn't use insulin properly, or both. Insulin's job is to move sugar from the blood into cells for energy. When that process breaks down, glucose lingers in the bloodstream, circulating through organs that were never meant to bathe in sugar all day. Diabetic kidney disease begins when that constant high blood sugar damages the kidney's microscopic filters, called the glomeruli. These filters normally act like incredibly fine sieves, cleaning waste from the blood while keeping important substances inside. Over time, sugar weakens their structure. They stop sealing tightly, and when that happens, protein, especially a protein called albumin, starts slipping into the urine. That leakage is one of the earliest physical signs that kidney injury has started. At first, the loss may be small, nothing dramatic, but inside the kidneys, scarring slowly builds. Healthy filtering tissue is replaced with scar tissue that cannot do the same job. With fewer working filters, the kidneys clean less blood. Waste lingers longer. Balance becomes harder to maintain. Kidney function gradually drops. If this process continues far enough, the damage can progress toward kidney failure. Why diabetes causes? This damage. What makes diabetes so destructive to the kidneys isn't one single moment. It's the long exposure. When blood sugar stays high, it triggers chemical changes inside kidney tissue. The tiny blood vessels within the glomeruli are placed under constant stress. Pressure inside these filters rises, their walls thicken. Their flexibility fades. Filtering becomes harder, not easier. As years pass, that strain fuels chronic inflammation. The kidneys are forced to work in an environment they were never designed for. Gradually, scarring develops, and each scar quietly replaces tissue that once filtered blood. Healthy structures don't regenerate. They're traded for non-working tissue that simply occupies space. With every patch of scar, the overall filtering ability declines. The most dangerous part is how unremarkable this feels. The process unfolds slowly, often across decades. The body compensates. Daily life continues. Energy may seem fine. Pain is usually absent. Because the kidneys can lose a large portion of function before symptoms appear, many people live for years without realizing anything is wrong. By the time kidney performance drops enough to register on routine tests or daily experience, significant damage may already be present. And that's when kidney failure becomes a real and growing risk. How common this really is. This is the part that usually catches people off guard. Diabetic kidney disease isn't rare. In the UK, it is actually the #1 cause of kidney failure. When that statistic sinks in, it changes the way diabetes feels. Kidney damage isn't a side issue. It's one of the most common endpoints of long-term diabetes. Roughly 30 to 40% of people with diabetes, both type 1 and type 2, will develop some form of diabetic kidney disease during their lifetime. That means nearly 1 out of every 3, sometimes closer to 2 out of 5. Those numbers shock many people because kidney failure is often spoken about as if it's unusual, when in reality it's a frequent consequence of years of high blood sugar. With type 1 diabetes, kidney problems usually appear later. Around 5 years after diagnosis, about 1 in 7 people already shows early kidney changes. After 30 years, that number can approach 4 in 10, with a smaller portion eventually needing dialysis. Type 2 diabetes follows a different and often riskier path. Many people live with rising blood sugar for years before they're diagnosed. By the time diabetes is discovered, kidney changes may already be underway. There's also an important equity layer. South Asian and Black people with diabetes appear to face a higher risk of kidney disease compared with white people, though researchers are still working to understand exactly why. These patterns highlight how biology, access to care, and delayed detection can quietly shape long-term outcomes. And now, we are heading to the main part of this video, that is, the signs and symptoms. Most people miss number 1, early silent phase. The most dangerous part of diabetic kidney disease is that, at the beginning, nothing feels wrong. No pain, no warning, no clear change that forces attention. Kidneys can quietly lose a huge amount of their filtering strength while life feels completely normal. Energy doesn't suddenly crash. Daily routines don't fall apart. Everything seems fine on the surface. But underneath that normal feeling, damage is slowly taking place. The filters inside the kidneys are being strained, weakened, and altered without sending out distress signals. Because the body isn't sounding an alarm, people don't look. And because they don't look, the problem often grows for years before it's ever discovered. Number 2, fatigue. Getting through the day starts to feel heavier than it used to. Muscles lose their spark. Focus doesn't come as easily. Even small tasks can feel oddly draining. As kidney function drops, waste begins to stay in the blood longer, and anemia can slowly develop. That means less oxygen is reaching the body's tissues. When that happens, energy naturally falls. But most people don't think kidneys. They think poor sleep, long work hours, stress, getting older. So the exhaustion gets explained away instead of examined. Number 3, loss of appetite. Food is often one of the first quiet casualties. Meals don't call the way they used to. Flavors seem dull. Hunger feels muted. Sometimes a low, unexplained nausea tags along. As kidney function weakens, waste products start interfering with appetite signals and taste. Portions shrink without effort. Interest fades. Many people assume it's mood, digestion, or lifestyle changes. They skip meals, change diets, drink more coffee, and move on. Rarely does anyone imagine that shifts in blood chemistry could be standing behind a disappearing appetite. Number 4, swelling. Swelling tends to show up where gravity sends it. Feet, ankles, lower legs. Shoes start to feel snug. Socks leave deeper marks. By evening, the body feels heavier than it should. When kidneys are damaged, they struggle to remove extra fluid and to keep protein where it belongs in the bloodstream. That imbalance allows fluid to slip out into surrounding tissues. It doesn't always hurt, it just sits there. Many people assume it's standing too long, heat, weight, or circulation, without realizing it may be their kidneys quietly failing to keep fluid under control. Number 5, puffiness around the eyes. Waking up with puffy eyes can seem harmless, a bad night, too much salt, allergies. But in kidney disease, this puffiness can be one of the earliest visible clues. When protein leaks into urine, the balance that keeps fluid inside blood vessels changes. Overnight, that fluid drifts into softer tissues, especially around the eyes. The face can look swollen before the rest of the body ever does. Because it fades through the day, people rarely take it seriously. It feels cosmetic, temporary. Not like something connected to internal organ strain. Number 6. Urination changes. Bathroom habits often change before people pay attention. Needing to urinate more often, especially at night, can creep in slowly. Urine may look foamy, almost soapy. That foam forms when excess protein leaks through damaged filters. As kidney control weakens, both frequency and appearance can shift. But these changes are easy to ignore. People drink more water, blame age, blame the bladder, adjust routines. What feels minor on the outside can actually be one of the earliest outward signs that the kidney's filtering system is losing its precision. Number 7. Anemia. As kidney disease moves forward, something deeper begins to happen. The kidneys normally release a hormone that tells the body to make red blood cells. When the kidneys are damaged, that signal weakens. Fewer red blood cells are produced, oxygen delivery drops, skin can look paler, weakness settles in, climbing stairs feels harder, breathing feels slightly shorter. This isn't just being out of shape, it's the body running with less oxygen than it needs. And without a clear pain point to point to, this kind of decline often goes unexplained for far too long. Number 8. Bone and mineral changes. Healthy kidneys quietly manage calcium, phosphorus, and vitamin D. When that system starts slipping, bones and muscles pay the price. Bones slowly lose strength. Muscles cramp more easily. Joints ache without a clear reason. Over time, fracture risk rises. These changes don't arrive dramatically, they build quietly. A little more stiffness, a little more soreness, a little less stability. Most people chalk it up to aging or wear and tear. Few realize that their mineral balance is drifting because the kidneys are no longer keeping that internal chemistry steady. How doctors detect it. Most of the time, diabetic kidney disease is found long before people actually feel it. And that's because doctors don't wait for pain. They look for quiet changes in urine and blood. The first test is usually a urine test that checks how much albumin is leaking out. This is measured using something called the albumin to creatinine ratio, or ACR. When that number sits between 3 and 30 milligrams per millimole, it's called microalbuminuria, which simply means a small but abnormal amount of protein is escaping. It doesn't feel like anything, but it's often the very first sign the filters are being damaged. If the number rises above 30, it means more serious protein leakage. Alongside this, doctors run a blood test to measure creatinine, which is used to calculate the eGFR. An eGFR above 60 is generally normal. Between 15 and 59 shows reduced kidney function. Below 15 means kidney failure. Sometimes urine looks abnormal while blood still seems fine, or the other way around, which is why both tests matter. If results are unclear, an ultrasound may be done, and in rare cases, a biopsy is used to examine kidney tissue. Catching changes early can completely alter how this story unfolds. Risk factors and who progresses. Faster, anyone with diabetes can develop kidney disease, but some people are pushed toward it much faster. Long-standing high blood sugar is one of the strongest drivers because it constantly injures the kidney filters. High blood pressure adds another layer of strain, forcing those already damaged filters to work under even more pressure. Together, sugar and pressure become a brutal combination. Being overweight can worsen both blood sugar and blood pressure control, quietly increasing kidney workload. Smoking further damages blood vessels, reducing healthy circulation through the kidneys. Family background also plays a role, with higher risk seen in people of South Asian and Afro-Caribbean heritage. None of these factors acts alone. they stack. And over time, everyday patterns, how blood sugar is managed, whether blood pressure is controlled, whether smoking continues, whether weight keeps rising, start to decide how quickly kidney tissue is replaced by scar tissue. This is why progression looks different in different people. The disease follows a lifestyle long before it shows up on a scan. Complications when kidneys decline. When diabetic kidney disease keeps moving forward, it eventually stops being something that hides in the background. The most serious point it can reach is end-stage kidney failure. That's when the kidneys can no longer clean the blood well enough to keep the body stable. At that stage, dialysis or a kidney transplant becomes necessary. Dialysis isn't a quick fix. It usually means spending hours at a time, several days a week, connected to a machine that does the filtering your kidneys can't. At the same time, the risk of heart disease and stroke rises sharply. Diabetes already puts pressure on the heart and blood vessels, and kidney disease adds another heavy layer by disrupting fluid levels, minerals, and blood pressure control. High blood pressure then feeds back into the damage, pushing kidney decline even faster. As kidney function falls, other systems start feeling it too, which is why kidney disease often accelerates problems throughout the body. Treatment pathways. Managing diabetic kidney disease is really about protecting what kidney function is still there. There isn't one magic pill that fixes it. Treatment usually starts with medications like ACE inhibitors or angiotensin receptor blockers. These lower blood pressure, but more importantly, they directly protect the kidney filters, even in people whose blood pressure isn't very high. Another group of medicines called SGLT2 inhibitors helps the body pass excess sugar through urine and also lowers pressure inside the kidneys themselves. A newer option, finerenone, then blocks certain hormones that drive kidney damage and is often used in people with type 2 diabetes and more advanced kidney involvement. Alongside medication, blood sugar control remains a cornerstone. Keeping HbA1c in a healthy range slows the damage process at its source. Blood pressure control is just as important because high pressure inside the kidneys speeds scarring. That's why some people need more than one blood pressure medication. Doctors also regularly review other drugs, since some medications can place extra strain on already weakened kidneys. Cholesterol control, often with statins, helps reduce the added risk of heart disease that accompanies kidney problems. Prognosis and outlook. What the future looks like with diabetic kidney disease depends heavily on when it's found and how seriously it's managed. When it's caught early, when only small amounts of albumin are starting to appear in the urine, treatment can often reverse those changes and bring levels back toward normal. Even when the disease is more advanced, the right approach can still slow it down and protect remaining kidney function. Not everyone with diabetic kidney disease ends up needing dialysis or a transplant. Many people never reach kidney failure at all. But kidney disease does raise the risk of heart attacks and strokes, which means long-term care isn't just about the kidneys alone. Managing blood pressure, blood sugar, and cholesterol together makes a real difference. Working closely with a healthcare team helps adjust treatment as the body changes, and that partnership is often what reshapes the long-term outcome. And then there are lifestyle measures, which often get overlooked but matter deeply. Stopping smoking protects blood vessels. Eating well supports blood sugar and pressure control. Some people may need to adjust protein or sodium if their kidneys are already struggling. Staying active and managing weight reduces strain across the entire system. These choices don't replace medication, but they decide how well medication can work. If this helped you understand what diabetes can quietly do to the kidneys, leave a comment if you learned something new, and don't forget to like, subscribe, and stay connected for more.